Hello everybody, I am Dr. Vandna Narula, Senior IVF Consultant at Motherhood Fertility and IVF Centre, Chandigarh. The fertility tests that are performed for the female. When a patient first comes to us as a couple, both the male and the female partners are individually tested. I'll be just talking about the test which we conduct for the female partner. Starting from the cervix, this is the cervix, which is the mouth of the uterus. We prefer to do a pap smear for the patient when she first visits us. We do a general physical examination, then a per speculum examination, and we get an opportunity to see for the cervical problems, any cervical erosions, cervical lesions, any polyp, etc., or any infection, and a pap smear is done. A transvaginal ultrasound is performed, and that transvaginal ultrasound gives us a general condition of the uterus and the ovaries. Any problem in the uterus and the ovaries can be diagnosed at the first visit itself. Any if cysts are present, like chocolate cysts or any other cysts, or any functional retention cysts are present, the ovulatory disorders, the follicle monitoring that can be done by TVS, the transvaginal ultrasound. Then the uterus, the endometrial lining, how thick it is, whether it is of optimum thickness at a particular day of the cycle, that can be seen when we do a transvaginal ultrasound. Any fibroid, any polyp, or any other structural defects of the uterus, that can be seen when we do a transvaginal ultrasound. Now, after the general physical examination, the per speculum examination, the pap smear, and the transvaginal examination, of course, all this is done after a thorough history taking. After this, we do blood tests. Then blood tests are basically divided into two parts. One for a general body examination. These include the routine hemoglobin, the urine examination, the liver function test, the kidney function test, the sugar levels, then the viral markers, which are done both for the husband and the wife, the vitamin D, vitamin B12. Well, then there are some specific fertility tests which include the hormonal tests for the female. They include the ovarian reserve testing, that is the anti-Mullerian hormone, the FSH, the LH, the estrogen, the progesterone, then the thyroid and the prolactin. These are done with a blood sample taken from the patient. Now, after seeing all these, what we have to do is the tubal patency test. The tubes are normally not visible on the transvaginal examination, and we need to do a tubal patency test, which can be done by Hysterosalpingography, that is normally done on the 8th or 9th or the 10th day of the cycle, where a dye is inserted and X-ray is taken, and it gives us a fair idea of the patency of the tubes. Suppose Hysterosalpingography, or the HST test as it is normally called, shows a block or a reduced spill in any of the tubes, we suggest further testing to the patient, that is laparoscopy and hysteroscopy. Laparoscopy and hysteroscopy has additional advantages of giving us a complete picture of the entire reproductive system and structures that are around. Also the inside of the uterus, and it's not only diagnostic, it is also a therapeutic procedure also, wherein the polyps, the fibroids, the adhesions or cysts, everything, and endometriosis also, these can be treated along with. Even the PCOD ovarian drilling can be done in the same sitting. Then comes the endometrial biopsy. The endometrial biopsy is normally performed on the day 1 of the periods. A very small curette is inserted through the cervix. It's a painless procedure, and the sample, the endometrial lining sample, a small bit of it is taken, and it is sent for testing for the histopath or for the gene expert for TB-PCR. Thank you.